If your days are measured in burp cloths, if you smell like sour milk 24/7, and if you are constantly changing your baby's outfit and yours, welcome to the club. Reflux. It is one of the most common, messy, and stressful parts of having a newborn. Almost 50% of babies experience some form of reflux in the first 3 months. But as a parent, it's hard to know, is this normal? Is my baby in pain? Or is this something serious like GERD? Welcome back to our channel. Today, we are diving deep into the world of infant reflux. We are going to explain exactly why it happens. It's a plumbing issue, the difference between a happy spitter and a baby with GERD, the mystery of silent reflux, and 5 actionable tips to reduce the spit up and save your carpets. Let's get started. To understand reflux, we have to look at anatomy. Think of your stomach like a tank. At the top of that tank, there is a muscle ring, a valve called the lower esophageal sphincter, LES. In adults, when you eat, this valve opens to let food in and then snaps shut tightly to keep stomach acid from splashing back up. It's like a lid on a blender. But in babies, this valve is immature. It's weak. It's floppy. Instead of a tight lid, it's more like a swinging door that doesn't quite latch. So, when your baby drinks milk and then lies flat, or gets their diaper changed, or simply giggles, that door swings open. The milk, mixed with stomach acid, travels back up the esophagus and out the mouth. Combine this loose valve with the fact that babies have a very short esophagus and spend most of their time lying down horizontally. It's a recipe for reflux. The good news? As your baby grows and starts sitting up, around 6 months, this muscle gets stronger, the valve tightens, and reflux usually disappears on its own. This is the most critical part of the video. You need to categorize your baby. Are they a happy spitter, or do they have GERD? Category 1, the happy spitter. Believe it or not, happy spitter is an actual medical term used by pediatricians. This baby drinks well, spits up large amounts of milk, looks messy, but then smiles. They are not crying. They are gaining weight perfectly on their growth chart. For these babies, reflux is a laundry problem, not a medical problem. It looks gross, but it doesn't hurt them. You don't need medication, you just need more bibs. Category 2, GERD, gastroesophageal reflux disease. This is when the reflux becomes a disease. The stomach acid is actually burning the lining of the esophagus. Symptoms of GERD include refusal to eat. They pull away from the breast or bottle after a few sips because it hurts to swallow. Arching. They arch their back dramatically while feeding. Poor weight gain. They aren't keeping enough food down. Blood in stool or spit up. This indicates severe irritation. If your baby is losing weight or is miserable all day long, that is GERD. That requires a doctor's visit. There is a third, tricky category called silent reflux. This is the hardest to diagnose because you never see the spit up. In silent reflux, the milk and acid travel up the throat, burn the esophagus, but the baby swallows it back down before it spills out. This is sometimes worse because it causes a double burn. It burns coming up and it burns going back down. Signs include sour breath, chronic cough, gulping, and frequent, wet-sounding hiccups. Before you ask for medication, pediatricians recommend these 5 lifestyle changes. They work for 90% of babies. Hack number 1, the upright rule. Gravity is your best friend. Keep your baby upright for at least 20 to 30 minutes after every single feed. Do not put them in a bouncer or swing immediately, as the crunching position puts pressure on the tummy. Just hold them against your shoulder. Hack number 2, smaller meals. Instead of big 6-ounce feeds every 4 hours, try 3-ounce feeds every 2 hours. Less volume means less pressure on that valve. Hack number 3, frequent burping. That air bubble acts like a plunger, pushing milk up. Burp your baby after every ounce or every time you switch breasts. Getting the air out prevents the milk from launching up later. Hack number 4, thickening feeds. Some doctors recommend adding a teaspoon of rice cereal or using special AR formulas. Never do this without asking your pediatrician first. Hack number 5, sleep position. Even with reflux, you must place your baby on their back to sleep to prevent SIDS. Do not use sleep positioners or wedges inside the crib unless prescribed. If these hacks don't work and your baby is losing weight, doctors may prescribe acid-suppressing medicines. These don't stop the spitting up, but they reduce the acid so it doesn't burn. However, these are used as a last resort. Here's the light at the end of the tunnel. Reflux peaks at 4 months and usually vanishes by 12 months when they start walking. It's messy, it's smelly, and it's exhausting. But you are doing a great job. If this guide helps save your sanity and your carpet, please like and subscribe. Join us tomorrow for day 14. Hang in there, parents.